A major part of the health care reform kicks in for the uninsured tomorrow.
Louisianians without health coverage can begin shopping for insurance through the health marketplace as the deadline to get it approaches. Tonight in Shopping for Your Health, Sabrina Wilson begins a series of reports exploring how the marketplace works and how it could affect you.
Hundreds of thousands of Louisianians are without health insurance. Keena Willis and Trey Roberts of Jefferson Parish are in that number. Willis has a mountain of medical bills from a West Bank hospital. She sees no way of paying.
That owed $60,000. I'm like, okay, I don't know what else to say.
Roberts' situation is just the opposite.
At this point, it hasn't really affected me. I'm relatively healthy. I'm still relatively young. My occasional visit to the hospital, like an injury from playing sports or something, is I go to the emergency room and just pay out of pocket for whatever care or whatever prescriptions that I need.
The federal government says 20% of Louisiana residents, or nearly 795,000 people, are uninsured. State health officials believe it's more like 16 to 17%. Starting October 1st, people without coverage can begin shopping in the so-called health insurance marketplace as a major part of health care reform rolls out. January 1st, the individual mandate takes effect, meaning most Americans must have health insurance. Louisiana opted out of setting up its own marketplace, so the feds are running it, and 4 Louisiana insurers are participating. Blue Cross Blue Shield, Humana, Vantage Health, and the new Louisiana Health Cooperative. Blue Cross Blue Shield and Louisiana Health Cooperative will offer coverage to people statewide. Vantage and Humana won't cover all zip codes.
It may be only 4 companies, but they are 4 big companies.
UNO's Dr. Walter Lane specializes in healthcare economics.
Obviously, they think that they're going to be able to make money, or they wouldn't be getting into the business. None of these are doing this for pure charity causes.
The feds say the Louisiana marketplace will offer a slew of choices.
There are 4 companies offering plans, but those companies have many different plans. And there will be about 40 that will meet the federally mandated what's called essential health benefit criteria.
Marketplace plans fall into 4 categories. Bronze, the cheapest, covers 60% of health care services. Silver, 70%, 80% under the gold plan. And platinum covers 90% of out-of-pocket medical expenses. Deductibles and premiums are affected by the plan you choose and where you live.
The higher you go, platinum, the more expensive, but the smaller copay required. The lower you go, the less expensive, but a higher copay.
According to the Kaiser Family Foundation, currently the average monthly premium for an individual in Louisiana with a private plan is $206. Under employer-based plans, an employee's annual contribution would be $1,217, or a little over $101 monthly. For a family of 4, it's $4,416 annually. In the new insurance marketplace, the feds say on average a 27-year-old New Orleanian who purchases the lowest bronze plan would have a monthly premium of $170. If that 27-year-old earns $25,000 a year and chooses the lowest bronze plan with a premium subsidy, the monthly premium drops to $74. For a family of 4 in New Orleans earning $50,000, the monthly premium for the second lowest silver plan would be $875, but drops to $282 if the family qualifies for a premium tax credit. All marketplace plans have to offer certain benefits like inpatient and outpatient care, trips to the ER, preventive care, maternity and newborn care, mental health and substance abuse treatment, contraceptives, prescription drugs, rehab services, lab tests, and pediatric services. Molly Demosthenes is part of Tulane School of Public Health.
It's vital. From a public health standpoint, we want the general public to have access to preventative care, to primary care.
And under the Affordable Care Act, women can no longer be charged more than men for health insurance.
Women now have access to free preventative services that they might not have been able to access before.
Louisiana isn't expanding eligibility for its Medicaid program, something states are encouraged to do under health care reform.
It's not that we're abandoning the uninsured. We're actually working very hard to make sure that the uninsured continue to receive health care services.
DHH Secretary Kathy Kleber says 29% of the state's population is on Medicaid, and expanding eligibility would up that significantly.
We feel very strongly that it will cost us anywhere from up to $60 million in the current fiscal year if we were to expand to over $1.7 billion over a 10-year period. Now, there are other estimates, of course, that make those estimates lower, but it would actually put over 41% of our population on the Medicaid rolls.
If you have Medicaid, Medicare, or a part of the Children's Health Insurance Program, you already have coverage and don't need to do anything in the marketplace. People with affordable private or employer-based plans can keep those plans. Illegal immigrants cannot participate in the marketplace. Some health care reforms have been in place for months. Young adults aged 26 or younger have been able to remain on their family's insurance plans. And barriers to coverage due to pre-existing conditions for all will no longer exist. Lifetime maximums are a thing of the past.
The things that have already gone into effect are the elimination of pre-existing condition exclusions. Well, that's a very costly thing for insurance companies.
And going forward,
The industry, the companies have said we should anticipate 30 to 40% cost increase in the next year as this goes into effect.
as part of the changing landscape for the insured and those who soon will be required to be so. I'm Sabrina Wilson, Fox 8 News.
Open enrollment for buying insurance through the healthcare reform marketplace ends March 31st, but special enrollment will be available beyond that for people with certain life-changing circumstances, like a birth of a child, a divorce, or the loss of a job. Tomorrow at 9 p.m., Sabrina looks at who may qualify for premium subsidies and how they work.